Hello, everybody. My name is Alyssa Howard, and I am the Associate Director in the Department of Wellness Promotion. Today, we are going to be going over who we are, vaping, alcohol, consent and sexual assault, sexual positivity, and sexual health. At Wellness Promotion, our mission is to provide students and the UAB campus with programs, education, and resources towards personal wellness. We do this through focusing on prevention and harm reduction efforts rather than being the fun police. We hope that through providing this education, our students will be able to make well-informed decisions on all of our topic areas, which are interpersonal violence prevention, substance misuse prevention, relationships, sexual health, stress, sleep, and self-care. We also recently launched the Feel Your Best campaign, which looks at easy and low-cost ways students can improve their overall well-being. You may see these little guys around campus on flyers or on social media. You can learn more about the campaign by visiting the website. There are a few ways that you can get involved with our department. First, you can take our class, CHHS 426. This is a 3-credit hour elective that can be taken by any student. It's listed as a 400 level course, but really it's more like a 100 to 200 level. During the class, you'll learn all about our topic areas so that you can start sharing that information with other students. This course is excellent for fraternity and sorority members because many of the issues that we talk about are topics you are making decisions about. This class is also excellent for those who are in or want to hold risk management positions and other leadership positions within your chapter. Another way you can get involved is by completing the Certified Peer Health Advocate program. The program consists of 4 60 to 90-minute workshops that give an overview of all of our topics: building blocks of peer education, prioritizing yourself, party smarter, and communication, consent, and contraception. The workshops are offered multiple times a semester and can be taken in any order. All dates for this semester can be found on our Engage page. Moving into our first topic for today, we want to clarify that for this presentation, we will be using the term vape or vaping as an umbrella term for any electronic tobacco delivery device. This includes e-cigs, vapes, vape or dab pens, tanks, mods, or pod mods. Fact or myth? Vaping is healthier for you than regular cigarettes. Research is still ongoing with this. There are still many unknowns about vaping. However, most researchers believe that it is equally as bad, if not worse, than traditional cigarettes. One reason for this is that it is common for people to keep the vape device in their hand so they continuously use it, which increases the amount of nicotine and tobacco they consume. Next question, fact or myth? Vape is equally or more addicting than regular cigarettes. This is a fact. Nicotine is the most addictive ingredient in cigarettes, and it is also found in vapes or e-cigarettes, sometimes even in higher dosages. Studies have shown that individuals who use vapes are not only getting more nicotine through the strength of their cartridges, but they are also using more frequently, like we discussed in the previous question, meaning they are forming higher dependency faster than traditional cigarette users. Our last question, fact or myth? People usually vape to stop smoking. Myth. Most young people who vape are not doing it to quit smoking. In fact, cigarette smoking among young people had been declining for years, but vaping has changed that trend. On our campus, 14% of students reported actively using vapes, which is actually really concerning for us. For our spring survey, 58% of our students said that they started using out of curiosity or just to experiment. While curiosity is normal, nicotine is highly addictive, and even casually vaping can lead to long-term dependence. Many also believe that vaping helps reduce stress, but research shows that nicotine actually increases stress on the body. There are lots of other healthier coping mechanisms that you can use in its place, like physical activity, talking to friends, or mindfulness. Moving on to our next topic, alcohol. In this section, we are going to talk about how you can get the good and avoid the not so good if you do choose to drink. There's a stereotype that all college students drink and drink a lot, but that is far from the case, especially here at UAB. There are some statistics that show just how different our students are. Of students who completed UAB's National College Health Assessment in fall 2024, 32% of students reported that they actually don't drink. 71% of students who do drink reported that they don't drink to get drunk, and 81% of students who drink consumed 4 or fewer drinks the last time they drank. If you do choose to drink, remember our method. Measure your drinks, eat protein before and during drinking, travel and stay with others, hydrate before and in between drinks, limit yourself to 1 drink per hour, and don't drive. Each of these protective factors can help ensure that you have the safest night possible. Let's talk more about how these can help. To measure alcohol, you need to know what a standard drink is. A standard drink is a serving size based on how much alcohol, or ABV, is in different kinds of drinks. Knowing how much alcohol is in a drink can help you regulate how much alcohol you're consuming. In general, a standard drink is 1.5 ounces of 80 proof liquor, 4 to 5 ounces of 12% wine or champagne, and 12 ounces of 5% alcohol. Beer. And so as you read in the previous slide, we recommend pacing yourself to 1 standard drink per hour, and we'll talk more about why that's important. But it's also important to know that not all drinks are standard, and that's why counting cups, cans, or bottles is not always accurate. We're taught to read nutrition labels on foods, but not always on alcohol, and that matters. For example, 1 wine carton that's pictured on the screen is 3 standard drinks, and that one is a little bit easier because it has it listed at the bottom for you, but some of these other ones are a little bit more difficult. So the PBR Extra is about 1.3 standard drinks. An 8-ounce Strawberita is 1 drink, and a Four Loko is 5.5 standard drinks. So just one can of Four Loko counts as high risk drinking. So reading those labels helps you understand exactly how much you're consuming. Mixed drinks are tricky because the alcohol content depends on what's used and who's mixing it, right? So sweet flavors make them easy to drink quickly, but just 1 Long Island iced tea can push an average person over the legal limit and count as high risk drinking. So this is even more important for communal drinks like Hunt Punch or Jungle Juice, since you can't calculate the alcohol and don't know what exactly was poured into it. Let's talk about BAC, or blood alcohol content. This is the amount of alcohol in a person's blood and helps us understand their level of intoxication. Everyone's BAC is affected differently by several factors. With sex assigned at birth, estrogen can slow alcohol breakdown, while testosterone may speed it up. Menstrual cycles, hormone therapy, and some birth controls can also affect BAC. With genetics, your body may naturally process alcohol faster or slower depending on enzyme production. Weight. The more body weight that you have or higher muscle mass can dilute alcohol, while body fat absorbs it a little bit differently. With the strength of your drink and your consumption rate, higher percentage drinks or harder drinks and drinking really fast can increase your BAC more quickly. And then lastly, with food intake, we want to make sure that we are eating before or while drinking, and that can help slow the alcohol absorption. What foods should we be eating before we drink? Many people think that eating carbs like pasta or bread will help when they're drinking, but that's not the case. Carbs digest really quickly, leaving your stomach empty, which means alcohol enters your blood a lot quicker. Protein and fiber-rich foods, on the other hand, stay in your stomach longer and slow alcohol absorption. Eating protein before and during drinking can help keep your BAC from spiking, making you feel better and reducing the risk of getting sick or nauseous. But it's really important to remember that eating after you drink won't reverse any impairment that you have. It's important that before you start drinking, you have already fueled up and have some food in your stomach. Next up, what is the point of diminishing returns? We tend to think that the more we drink, the more euphoric and happy we will feel, but that is actually not the case since our bodies can only handle so much alcohol. So the point of diminishing returns is exactly that, the point when one more drink kind of pushes you over that edge. So alcohol is considered biphasic, meaning that it has two phases. There's a point where our bodies stop experiencing the pleasant side effects and begin to experiencing those more negative things. And so that could be hangovers or fatigue or all of the things that are on the next slide. So let me go on to that one. So the first phase of the biphasic curve is while BAC is lower, the effects of alcohols may have a mild buzz or a pleasant high. The second phase, however, is when you have higher levels of alcohol concentration. The effects of alcohol become more negative, including, like I was mentioning, fatigue, physical impairment, and impaired judgment. This is an important time to talk more about binge drinking, which you may have heard me talk about previously. Binge drinking or high-risk drinking. And that is defined as having 4 to 5 standard drinks within a 2-hour period. When somebody is participating in this high-risk drinking, they are much more likely to fall into phase 2 of the biphasic curve and experience the not-so-good parts of drinking. The only thing that can truly help sober somebody up is time. On average, the body can process only about 1 standard drink per hour. People try to speed it up with coffee, cold showers, or energy drinks, but these can only make someone feel more awake. They don't actually reduce the alcohol in their system. Eating before or during drinking, like I mentioned, can help slow the alcohol absorption down, and staying hydrated can help reduce hangover symptoms later, but neither are going to sober somebody up instantly. The safest approach is to plan ahead, pace your drinks, and allow plenty of time before driving or doing anything that requires your full attention. Sometimes drinking too much alcohol can overwhelm the body, and time alone is not going to be enough. Alcohol poisoning is very serious. It can cause your breathing to slow or stop, the heart to beat irregularly, and gag reflex to shut off, which increases your risk of choking. So remember cups to spot those warning signs: cold skin, unresponsive, puking or slow breathing, and you may sometimes hear shallow breathing as well. Other warning signs could include confusion, vomiting while passed out, seizures, or bluish skin or lips. If any of these occur, call 911 immediately. Even if you're unsure, it's safer to get medical help than to wait and hope that they sleep it off. Alcohol poisoning can happen to anyone, and even if they're experienced drinkers. At this point, you've probably heard about our medical amnesty policy, and ultimately, we have that in place because we want our students to be able to get help. It is important that you call for help. So if somebody is showing those signs of alcohol poisoning, we want you to act quickly. Like I said, first, we want you to call 911, try to wake them up if possible, and stay with them. If they're unconscious but still breathing, place them in the recovery position. You can kind of see that in the picture there. So we want them on their left side, head tilted slightly back, in an attempt to keep their airway clear and prevent choking. It's also important to be honest with emergency responders about what and how much they've drank. This can help them provide proper care. We want to make sure that you are not leaving them alone, trying to force them to drink water or take a cold shower. Some of these actions can make things much worse. If vomiting occurs, we want to make sure that their head is tilted to the side, like I said earlier, so that they don't choke. And ultimately, the main takeaway from this is never underestimate the danger of alcohol poisoning. The quicker you can intervene in this situation, the better. So just to recap, here is our method again. Measure drinks, eat protein, travel with others, hydrate, 1 drink per hour, and don't drive. If you or others are drinking alcohol, situations can arise that will call for you to be an active bystander. Being an active bystander is someone who chooses to do something to reduce risk of harm or to help someone in need. To be effective, there are specific techniques people can use so that the intervention works, does not put you or the other person in an unsafe situation, and does not escalate the situation any further. You can intervene directly by causing a distraction. Uh, wait, yeah, you can intervene directly, and that's in the moment with that person, directly about what's happening. You can distract by creating some kind of distraction and pulling people away from whatever situation is happening. And then you can also delegate the intervention to someone who may be more equipped to handle the situation. Two more interventions or strategies to intervening are document and delay. These won't always make sense, but they can be very useful for certain situations. You can document by recording or taking notes during an event. This one is important, for example, if somebody is extremely intoxicated and maybe you're concerned about their use. We're taking notes of those situations and combining that with delay, waiting until a later time to have that discussion, right? If somebody is really intoxicated, then if they're intoxicated, they may not receive that correctly, right? So we would delay until a later time till they were sober, and maybe open to that. Obviously, like I mentioned, there are other times where where delay does not work. So if somebody was experiencing alcohol poisoning, delay would absolutely not be the action we would want to take. So here's a scenario that you may encounter while out drinking. You notice that one of the players in a drinking game appears to be very intoxicated. They eventually say they want to stop playing, but other players urge them to keep playing. Think back to the 5 Ds we went over in the last slide. What would you do in this scenario? You can be direct with the person who is intoxicated by asking them to come with you somewhere else, or direct with the people pressuring them by asking them to stop. You could delegate to the host or another friend to intervene, or you could cause a distraction by spilling your drink on the table or getting the players to focus on something else. In this instance, document and delay may not work. And so I challenge you to think about what are some other instances that involve alcohol that would require someone to intervene. And so one of those examples comes into play when we talk about alcohol or other substances and sexual assault. It can be difficult to know if someone is too intoxicated to give consent, especially if you're under the influence too. When someone is under the influence of a substance, it's likely that they are experiencing lower inhibitions and impaired judgment. Another important part of obtaining consent is making sure that the other person is capable of mentally, physically, and verbally giving consent. So I always challenge people to think about if you're blackout, typically you don't know that you're blacked out until the next day. And so brownout is you remember bits and pieces of the night, but you don't remember everything. And so to everybody else, blackout, people who are blacked out look like they're going about their nights the same way. And so if somebody consents in that state, then that's technically not them giving consent, right? If they don't remember anything the next morning. And so, like I mentioned, it's difficult to know if somebody is too intoxicated. But ultimately, if somebody is buzzed or drunk, then we try not to make any big decisions. If somebody is at the point of incapacitation, they absolutely cannot consent. So, like I mentioned, it could be hard to tell, but some signs that you can look out for are loss of motor function, vomiting, slurred words, and declining cognitive function. Unfortunately, 90% of campus sexual assaults involve the use of alcohol. And this does not mean that alcohol causes sexual assault, but it is a substance that can make consent, which is already kind of gray, even more difficult to understand. So Even if both or all individuals are under the influence, it's important to know that the person who initiates any sexual act can be held responsible. Um, and so if both people are drunk or under the influence, the excuse that, oh, I thought that they were fine because I was drunk too, so I couldn't know, da 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 da, whatever. Unfortunately, the person who initiates can still be held responsible. So if you ever have to question if somebody is too drunk to consent, then assume that they do, or that they are. So I always say, if it's not a hell yes, it's a hell no. A major component of avoiding sexual assault is obtaining consent, like we were talking about on the last slide. So, consent should be the first step of any sexual encounter. It is verbal, informed, voluntarily given, and a mutual agreement to participate in a particular activity. It also can be withdrawn at any time. So, we like to use the phrase consent is like fries, freely given, reversible, informed, enthusiastic, and specific. Some examples of ways that you can ask for consent are, do you want to have sex? What do you want to do? Is it okay if I do X, Y, and Z? How does this feel? Or should I keep going? On the other hand, consent is not the absence of no, silence, being in a relationship, making assumptions, coercing, or intimidating. It's not a maybe, it's not an I don't know, or an I don't want this anymore. Understanding what counts as consent can be confusing. If you are unsure if you have consent, then once again, the safest option is to assume that you don't. So say it with me. If it's not a hell yes, it's a hell no. Just to put things into perspective, here's some statistics for our students and rates of how much we are experiencing sexual assault while in college. So these numbers are pretty alarming and very sad. And when you look at these, it does look very different for men. So 1 in 16 men. But what I like to point out about this is that college age men, so the 18 to 24-ish range, are 4 to 5 times more likely to experience sexual assault if they are in college than without. So another way to say that, men ages 18 to 24 who are in college are 4 to 5 times more likely to experience sexual assault than those the same age who are not in college. So this statistic, although it looks different from the others, is still pretty important. So you can take a stand against sexual assault once again by being an active bystander, holding your friends accountable, and by promoting a culture of consent. Here's another scenario to practice the 3 to 5 Ds. You're at a bar when it closes, and while waiting for an Uber, your roommate is talking to a woman who is clearly slurring her words and swaying back and forth. He tells you that he wants the room for the night for himself and his new friend. Take some time to think about what you would do in this situation. What are the signs that this person may be too intoxicated to give consent? You may have to intervene in a situation where you or the potential victim might know the perpetrator. Don't assume just because you know them or they know them that they are not at risk. 80 to 90% of sexual assaults are most commonly perpetrated by acquaintances, and for college students, it's closer to 90%. An acquaintance could be a partner, a close friend, a friend of a friend, or just someone they recognize from class or their residence hall. So unfortunately, given those statistics, there are going to be times where we know somebody who has experienced this. And when that happens, it is super important that you, number one, believe them. Statistically, we know that it happened. And if there was a room or reason to lie, then that friend may need some other like support, right? So we want to make sure that first of all we are believing them and we're never blaming them. So if somebody shares this with you, we want to make sure that we're really careful with the questions that we ask. Sometimes they come from a good place, like, did you tell the person no? Were you drinking? And even in those instances, those are good intentions and people are trying to figure out what's going on, but it still does apply. like some blame, right? So it doesn't matter if somebody said no, did they say yes? Were they drinking? That also doesn't matter. We want to make sure that we're promoting our resources, and there's lots of resources around campus, like Title IX, the Victims Advocate Unit with the UAB Police Department, and lots more. And we also want to make sure that we let them decide what they do about it. Obviously, when our friend shares something like this with us, we want to make sure that that person pays, right? We want to hold them accountable for what they've done. But ultimately, your friend or whoever is sharing this with you has just gotten a lot of their autonomy ripped away, right? So the last thing we want to do is to further that and take charge of this situation. Okay, so we've talked a lot about consent, and consent is great and wonderful, and we love it, but consent is our favorite bare minimum, right? We want to make sure that we are doing more than that. So let's talk about what that looks like. We want to make sure that we are being sex positive. And what that means is it's a culture where everyone, regardless of any of their practices, can make their own sexual decisions without judgment or stigma. One in which men and women and non-binary people alike recognize the value in communicating before and during sex. One in which boundaries are respected and not seen as a challenge to break. It takes some rewiring to start thinking about sex in a positive way, because most of us have been conditioned to think that sex is a really taboo topic. One quality of being sex positive is to understand that sex is natural and a natural and healthy part of life, and it isn't something that you should be embarrassed about. Some other qualities of a sex positive person are recognizing that sexual boundaries should be respected, um, accepting other people's orientations, lifestyles, practices, all of those things, and then being more open to learning about sex and sexual activity. I always like to say that we aren't here to yuck anybody's yums. If you don't like it, don't participate in it, right? So once again, we have to be accepting and respect other people's sexual behaviors. If they are being safe and getting consent, we shouldn't yuck their yum. And so the way that I always think about this is that I'm a super picky eater. Like, I'm a super picky eater, and my least favorite food is onions. So if I don't like onions, I can't expect nobody else to like onions, right? And if I'm sitting there while somebody is eating and I'm like, ew, 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 nasty, I hate onions, what does that do for anybody, right? Let people enjoy their meal, let people enjoy what they like. And once again, if you don't like it, don't participate in it. Okay, so when we talk about safe sex, most people's first thought is the use of contraception. Of course, this is correct, but having safe sex involves so much more. Abstinence is the only way to completely avoid unplanned pregnancy as well as prevent the transmission of STIs. But since we know that sex can be a healthy part of someone's life, there are other ways to make sure that you are staying safe. First, discussing sexual histories. Although this may feel a little awkward, it's important to be open with your partner. This could include sharing if you're having sex with more than one person, having sex unprotected, or sharing when the last time you were tested for STIs was. Getting routine STI testing is another way to, or another part of having safe sex. If you are sexually active, you should be getting tested at least once a year. However, if you have more than one partner ever participate in unprotected sex, you should get tested at least every 3 to 6 months or before having sex with a new partner, as well as if you believe that you've been exposed. So next, setting and respecting boundaries. The first step to establishing boundaries is taking time to think about what your values are and what you want. Once you have these answers, it's time to discuss those with your partner. It's likely that you and your partner have differing levels of knowledge, preferences, or sexual experience. And then moving to the next one, we want to make sure that we are using contraception correctly. I take the time to emphasize correctly because typical use of contraception is what we most commonly see, and this decreases the efficiency or effectiveness of contraception. For example, when they're used perfectly, a condom is 98% effective. With typical use, though, it's only about 85% effective. So there's many things that can influence typical use of contraceptions. And I think about with birth control pills, if you aren't taking them at the same time every single time, that can make it more likely to be towards typical use. And same thing with keeping a condom in your wallet. So of course that's a good practice to have be ready. But when you're walking around with your wallet and it's rubbing and creating friction, then that can start to break down the barrier of the condom. So that would make it more typical use than perfect. But ultimately, it's on everybody to be responsible for safer sex. And I asked the question, whose responsibility is it to have a condom? And that is anybody who's planning on having sex. So start to think about the ways that you can start to practice this. All right, so let's talk about how you can get sexual here on campus. So in our office, you can stop by at any point for condoms, lubrication, and emergency contraception. You can also get this from Student Health Services. I also want to mention that we have free STI testing on campus for students. So twice monthly, we have walk-in free STI testing where students go to a bus and you walk up. You don't have to give insurance. We don't get the name, so it's completely anonymous to us. They have your name so they can contact you with results, but unknown to our services, to our office at all. And then we also have free take-home self-testing STI kits, which is something new and something really exciting. And you can come by, once again, Student Health Services or our office at any point to be able to grab those. Okay, so I know that that was a lot of information, but there are still some main points that I want you to take away today. So a lot of the things, like I said earlier, we're not the fun police, and a lot of the things that we talk about, we talk in terms of safe use. How can we use this safely? But with nicotine, that is the one thing that we talk about, that there is no level of safe use. And that's what the research says, right? So I also want to mention that you can still have fun while drinking responsibly. So remember what the method stands for. Also, not all students choose to use, and that is also okay too. It's very normal. Substances and sex can get very messy. Consent cannot be given when a person is incapacitated, and protection is less likely to be used properly or at all. It's on us to stop sexual assault. If you see something, say something. Hold your friends accountable. Remember the 3/5 Ds. Know what consent is and is not. And then also the final, be sex positive by always getting consent, seeking the most pleasurable and safest sex for all parties, and never shaming somebody for healthy and consensual sex. So thank you for your attention today. I hope you learned something new. You can follow us on Instagram at Wellness UAB to stay up to date about any events that we have going on. And if you or your chapter ever want any trainings or activities, we would love to come out and help with that. You can email us at wellnesspro@uab.edu or submit a request on our website. Thank you.